Hi everybody, welcome to UEA's Nursing Podcast. I'm Joe Ellis-Gage, and today we have a Meet the Lecturer episode with Katie. Hi Katie.
Hi Joe.
So thank you for coming in to do our Meet the Lecturer, so we can find out about you and your career and what got you to this point. So let's start with just the basics. Who are you and what's your role?
Who am I? Well, I am Katie McGee and I am an Associate Professor in Children and Young People's Health and Nursing. And I'm a registered children and young persons nurse, and I have been here at the University of East Anglia since 2011.
Okay, so one of the more established members of the team.
Furniture.
Been here a while. No, an important part of the team. Okay, cool. So that all sounds very fancy. With associate professor and all of that kind of stuff, very important. But at some point in your life, you were a student nurse, just like a lot of the people that will be watching this.
Yeah.
So what we'd like to find out at the start is how and why you ended up in nursing. Everyone seems to have a different story as to how they decided to or why they became a nurse. Some people don't really know. Some people knew they were going to be a nurse from 3 years old. What got you into it?
Okay, so I'm going to be really honest with you. I didn't have the calling that some of us have had, but I think what I wanted to be was a journalist.
Okay.
Join the Navy or work in a fruit and veg shop. And I know that's a real diverse range.
There's still time.
There is still time. I still hanker after those things. But for various reasons, I think the reason that I found myself in nursing was I spent an awful lot of time in hospital, both in and around Norwich and also in London at Great Ormond Street as a child, which was hugely life-changing for me and my family. So whilst I didn't naturally progress toward it, because I'd spent so much time in hospital and around healthcare, it kind of felt like the natural coming home, maybe, so to speak, when, I'll be really honest, I didn't know what to do. I got to that age where I didn't do so well in GCSEs, I didn't do so well in A-levels, because I was very distracted, lots going on. So I reached a point where, what shall I do, what shall I do? And it just felt a very natural progression for me.
Because you've been exposed to it, you kind of go, I could do that, and it just sort of happened.
They're good people, they do some good things, and I'd met some fantastic nurses and healthcare professionals, some not so as well, and I think it just felt like a habitat that I could develop in. Yeah,
but you're not the sort of dressed up as a nurse when you were 5 and knew that would be it for the rest of your life. You weren't dead set, it was a decision.
No.
I've often heard you say, best decision ever, and it makes it realise that it wasn't your calling as such, it was a choice.
That's a really good way to describe it. It was my best decision ever, but I didn't know that until later in my life. And part of that is due to the work itself and the things that I've done and the people I've seen, but much of it is from the fantastic, course that I did, the friends that I've met, which are, friends for life. And I think this is probably a bit cheesy, but the whole developing as a nurse, it's a tapestry within your whole personality, and it transfers. I mean, don't get me wrong, I have a good time, I have lots of fun, but I think being a professional just transfers into so many parts of your life. And I think you just, even though I don't care for children and young people directly now, because I'm not physically nursing day to day, I'm training and educating the nurses of the future, and that's a real privilege.
And it's more than a job, isn't it? Like, you can't just do it as a job and go home and forget about it. No. It's far bigger than that. So where did you do your training?
I trained at King's College in London. I went there in 1995, and that was back in the day they had something called Project 2000, and I did a diploma, and again, honesty. Full disclosure, I didn't do as well in my A-levels as my parents hoped I would, but we had the option then to either do a degree or the diploma, and I went and did the diploma. Again, with the life that I've had, the friends that I've made, I since did my degree and my master's. At my pace, when I was ready, it was just the best option for me. Yeah,
so it worked that way. That's interesting. And when you did your training, did you find that you knew immediately that was the right decision? Like you once you went and did your first placement, or you started learning, you went, yeah, this is it. This is for me.
It was the first day. It was a skills lecture.
Okay.
And there was a lecturer. I remember her. I won't probably say her name because I'm probably not allowed to do that. But she was very into performing and theatricals, and I was drawn to her because of that, because that's my kind of something I enjoy as well. And she talked about when you are seeing to a patient's personal hygiene, you know, whether it's bathing them, washing their hair, whatever, that it's an art, it's not just a task. And she, you know, she was very over dramatic, and it was all, and I sat there and I watched her, I thought, oh, I want to do that one day. And I was asked, and I'd watch like the lecturers in a meet, and I'd just think, I want to teach about these really interesting concepts that are just about life and people and families. And although you have to learn so much scientifically, there's so much that's just part of our lives, because we're all service users, aren't we? We've all got health and well-being needs. So I was asked on that first day, you know, where do you want to go in nursing? And, you know, friends were saying, I want to be a, you know, ITU nurse, I want to work in A&E, want to work in a community, school nursing. And I said, I want to do what you're doing. I want to be a lecturer. I knew instantly. That's
interesting. You're the second person I've interviewed who've said on their first day they decided they want to be a lecturer.
Yeah.
Like they knew that would be the long term where they'd end up.
I want to teach this. I want to share this knowledge, because it just had such a huge impact on me to learn to then go out and practice. I loved practice, but I probably enjoyed the theory a little bit more than the practice, perhaps.
Yeah, which is probably, I don't know, maybe rarer than some.
I would say, yeah.
But obviously you didn't go straight into practice, or straight into education. You went and did your course. Mm-hmm. Where did you go and work when you qualified? Yeah,
so I qualified in 1998. I have to rack my brains here now. And then my first nursing post was at Guy's Hospital, or it might have been St Thomas's. Guy's and St Thomas's were obviously joined together. They've now got a children's hospital themselves, but they didn't have at the time. And I worked first of all on the surgical ward for a couple of years, and then I moved to the medical ward, and I became an E-grade staff, which is I think it's all different now because the bandings, but
like a senior staff nurse.
Yeah. No, I don't think it was. I think senior staff nurse was F, wasn't it?
Okay.
Back in the day. So it was my first step towards a senior staff nurse. So I'd done surgical and I'd done medical, which was a brilliant combination to get a real all-round general, you know, children, young peoples with long-term conditions, with acute surgical needs. And then I moved back to a surgical ward, but I worked with children and young people with very complex health needs and disabilities that required orthopaedic surgery, scoliosis surgery and such like. And I gained a real interest at that time in pain management for people who are non-verbal. And that took me then to probably my most rewarding nursing post, which was a clinical nurse specialist post at Great Ormond Street in pain management. And I did my master's and I did it around that subject, and I was interviewed by the BBC and I published, and it was I was really pushed to do so. It would have been easy just to, you know, go along, but I had some fantastic supervisors, and there was just a real vibe at Great Ormond Street of, you know, we have this knowledge, we have to impart it.
Yeah, and it wasn't just doing, again, like not just doing a job, it was like developing and pushing forward and making
leading
things
change.
better.
Yeah, it was very much about that. That's what my master's was in, professional leadership in healthcare. And that's put me in such good stead, whether it's working with people clinically or whether it's working in an education environment with colleagues and with students and practice partners.
Yeah. Oh, that sounds really interesting. So when you were doing that role, did you kind of had oversight and went into all the different areas of the hospital and would be supporting the nurses caring for these children in their pain management? Yeah,
so it was Pan Trust, and as you can imagine, at Great Ormond Street there was lots of different wards and specialities. So yeah, we'd support all across the board, from general, from oncology wards to different specialities of surgery, and then also neonatal intensive care, paediatric intensive care, theatres, recovery. So I was kind of here, there, and everywhere.
Yeah.
But the main idea of the role was to help develop, helping clinical consultancy around complex cases, rather than sometimes, you get the bleep and it's, I've got a child here in pain. Well, you're a nurse.
You should be able to deal with that.
You've got to deal with that. So it's really interesting. I think, and that's probably where my I'd always had an interest in education, but I think at that point realising that we had such agency to help others, move forward with their knowledge. So I think education became such a big part of my CNS role, and I'd find myself doing quite a lot of the, teaching around that. But, there was lots of things involved, from, clinical work with people one-to-one, bedside teaching, to research and audit, lots of leadership and kind of changing services to develop them. And
so lots of stuff that you probably hadn't really thought was part of nursing when you went into nursing.
Very much so.
Not just the bedside care stuff, like a whole wide range of things.
Yeah.
Interesting.
Yeah.
And so then how do you get from that role, sort of starting to do a bit of teaching, seeing how you can kind of educate others, to being here at UEA and being an associate professor?
I'm somebody who makes a decision. I don't think about something very much, and then I think about it for a few hours, and I make a decision, and I just do it. And and is it going to work or is it not? Let's see. And I made a decision to call up one of my old lecturers at King's College in London, where I'd trained and where I'd done a lot of my post-reg education. Yeah. And I phoned her up, and she had supervised me through my masters. So we'd done we'd had this professional relationship, but we'd become friends after I'd finished my course. And I called her and I said, look, I really want to be a lecturer. What should I do? And she said, well, you've got your master's, so that's a really good step, but call, and she gave me the name of somebody to call. I think you might be in luck. And I made a call to the head of the children and young people's and midwifery team, nursing team. And they said, yeah, we've got a job, come in and have an interview. And I went and had an interview, and I got a job. And I was suddenly like, oh, I'm a lecturer. It's
like, I want to do that. And then you're doing it.
And I'm now going to do it. And then suddenly it just felt really real. But it happened so quickly from me making the actual decision. So I think things are different now in terms of how you progress towards these things. But I think the more education you can get under your belt, the master's put me in such good stead for it. It was hard work. I'm not going to, paint it as anything other than that. Working full time, doing studies. And it is easy to say, oh, I'm not going to do anything else. Hence, I'm doing my doctorate at the moment, which wasn't in the master plan. Yeah. But I think it's just all about when you actually learn and can impart that, whether you're teaching somebody or working directly with a family, a child, a young person family, we just have such a privilege in our hands to share that.
And what do you enjoy most about being a lecturer?
I think I love the atmosphere of higher education. I think there's lots of stresses and strains with it. I would say it's so different every day. I work with brilliant team and so many different people. So the people that I work with is fantastic. But, some days you're doing this that I'm doing now. And then this afternoon I'm going to be working with my colleagues, helping students to decide what placement pathways they want to go on. And then I'm going to be recording a presentation that I'm doing for the neonatal module tomorrow. Yeah. And it just... Then I'm going to be catapulted into a lecture with 300 students, which, again, still makes me feel a little bit sick and my heart beat faster, but that doesn't do any harm to want to be on your A game. And then you're working skills sessions and, really closely with people and talking about very deep, intense, complex scenarios that people go through. So I think it's the variety. I think there's just a lovely atmosphere. Everyone's really happy to be here. And I think there's just something about combining healthcare and education. There's a kind of nursing culture, I think. We've all got brilliant senses of humour, most of us have. I think that gets us through. But I think we do, putting all of that aside, we really do care about people, and we care about, people's health and well-being is everything. It comes above everything. And so I think it gives us more of a fighting chance to be happy at work, maybe, that we're doing that.
Yeah, I guess that everyone who's become a nursing lecturer has gone through that nursing process and really wants to make a difference. They're not just here because they're interested in a topic, like they've been through the process to get to this point.
Yeah.
And it's interesting also listing some of the things you're doing, because one of the things that's I think useful for students to see is what we're doing when we're not in front of them, because it's not like school teaching necessarily where teachers are in the room all day and they're teaching, and everyone knows that our jobs are so varied that we do so many different things in the course of a week. It's kind of hard to quantify. So you've given some interesting examples of what else we do.
Yeah.
Not to mention all of the looking after students and well-being and advising and marking and planning and everything.
Yeah.
So thinking about the new students, and we might have starting here now, if you were to give some advice to a group of students and they were nervous at the start of their 3 years, or even just thinking about applying and they haven't got to this point yet, what bit of advice would you give them that would make them get the most out of their training?
I think I would probably say the academic side of things can be really daunting for people. And I think that's whether you feel you're naturally academic or not, because it is a step up. You're you're going to university to do a degree, but on top of that, you're developing to become a professional, and that's really different to going to do, I don't know, a history degree, for instance. So it's kind of it's a double whammy in a way. So what I would say is it doesn't matter how academic you think you are. I think you should just apply yourself 110%. And I know from what I've seen of students over the years that have been really successful, they're not necessarily the A-grade students. They're the students who just work so hard in their own time to plan and organise. And I think it's a bit boring, really, and I sound like a bit of an old mother hen saying it, but I'd say if you're organised, keep at it and step it up a notch. And if you're not, sort it out, find ways, find tricks and tips. Because if you're organised and a step ahead of the game and you do independent learning and you have a curiosity in things, I think that's the trick, isn't it? It's about not just going through a checklist, having a natural curiosity to learn. It becomes more fun and therefore it becomes easier than if you constantly burying your head in the sand and think, it's hard. We're not going to lie about that. It's hard. And the reason it's hard is because it's such a privilege. It's a privileged course to be on, and it's a privileged registration and degree to gain. So I would say that. And the only other thing I would say, which I think should always put fire in bellies, is you're going to be out there caring for the public across the life course, and think of people that you're caring for as you would want your loved one to be cared for. Yeah. Whether that was your mum, your dad, your spouse, your child. It's really easy to get bogged down in the minutiae and the stress and strains of work and our own things that are going on in our own personal life. But you can make such a huge difference if you have an attitude of caring as if it was somebody that you knew, and that will not go unnoted. And I think the satisfaction you get from that, I think then all the other things come alongside that really naturally. What other career is there that gives you that, just glimpse and privilege into other people's lives, I think.
It's quite a privilege, isn't it? Yeah. Okay, that's really good advice. So you've got the looking after others as you would want your own nearest and dearest to be looked after. Yeah. And kind of be organised in that academic work from the start and really kind of step that up. Because you're right, a lot of the people that come into it because they really want to become a nurse, not necessarily because they really want to study within higher education. They're capable of it, but that's not their driving bit behind it. But they can all do it. It's being on it from the start. Yeah. Excellent. Well, thank you very much. We've found out a little bit about you, and students that will see you more often over the next few years will meet you and find out lots more. Hopefully you found this episode interesting. If you have any comments, you can add them in the comment section below. You can click like, you can click subscribe, and find out more about the other lecturers that we've got. And you'll have more alerts when we get more videos published. But thank you very much, and thank you for coming.
Thank you for having me.
No worries. Thanks.